Hi children, this is your social man. See, today we are going to see social and political life. In that part, we are going to see chapter 2, role of the government in health. So, you will ask one question children, what is the government is doing for our health? We are eating and we are living. Is it? But now you people understood that what is that part of government is doing in this corona 19 situation. Yes, so the government creates lot of awareness about this disease to the people, and also it provides lot of services and treatment for the people. So we are considering our government yet consider the people's welfare in all the time. So that we are going to see in this chapter. See the next slide, children. So these are all the contents we are going to see. Introduction. What is health? Healthcare in India. Public and private healthcare services. Public health services. Private health facilities. Healthcare and equality. Is adequate healthcare available to all? What can be done? The Kerala experience. The Costa Rican approach. Check your knowledge. So these are all the contents we are going to study in this chapter. See the next slide, children. Introduction. So in this chapter, see the picture. This we can call it as camp conducted by the medical students to the various places in our India. So in this chapter, we are going to learn the meanings and problems related to health. So what are the problems we are facing and what is the meaning for the term health? That we are going to learn. So, what is health? Health means our ability to remain free of illness and injuries. Yes, if you are free from the disease, we can call it as health. But health isn't only about disease. It relates to get clean drinking water or pollution free environment and food. So we need purity to these things, then only we will be in active and in good spirit. But sometimes we feel dull, inactive, or scared leads to unhealthy. See the next slide, children. Healthcare in India. So we have a number of doctors, clinics, and hospitals. And also we can have that much of knowledge persons to run public health care. That means government related services. And also in our country only we feel lack of services in healthcare. Why it is happens? That we will see. So we can have two types of healthcare in our India: private healthcare and public healthcare. So you want to read page number 21 and page number 22 and 23 to know about private and public healthcare treatment. See the next slide, children. Public health services. So we have two types of healthcare, private and public. So now we are going to see public health services. The public health service is a chain of health centers and hospitals run by the government. So, what are all the centers run by the government to provide service to the people? That we can call it as public health services. In our village, the government hospital, we can call it as primary health center, that is PHC, primary health center. So there we can see a nurse and the worker. And also in cities, the government hospital is called as district hospital. There we can get lot of services, and also the district hospital servants they want to supervise the village centers also. See this slide children, you will understand. So the area ministers and also some other supervisors are there that we can call it as health inspectors. So they will visit various places and hospitals. They will supervise how the treatment is going on. So that's why it is called as public. Public means to provide health care to all citizens. So they will not hesitate to give treatment to the particular persons. They'll give treatment for all of them. So how they'll get money to run these type of hospitals? How this government is getting money from tax? So we are paying different types of taxes. So from that they'll get money and they'll want to say, provide service to the people. And also that government hospitals they want to do some duties. They want to provide services for free or low cost. They will not charge high cost of amount for the treatment, and also need to take action to prevent the spread of diseases. Yes, now what is said, we are in the period of corona. Yes, the government involved a lot to cure this disease. See the next slide, children. So, according to our constitution, the government must work for the people welfare. So, what does mean by constitution? Constitution means we can have set of laws to the welfare of the people. So, in that, what is it? The government must help to the people. So, in village, we can have we can call it as primary health center. So there, the nurse and the workers they will help us. If that hospitals refuse to give treatment for the people, then you can appeal to the court. For that, we can use our fundamental rights. So that are also stated in that constitution. So we can use that and we can appeal the court. So next one is private healthcare facilities. So a large number of private hospitals are available in our country. Yes, children, nowadays we are not moving to the public hospitals. That means what is it? Government hospitals. Everyone are running to the private hospitals, and also there we are spending lot of money, and also we are spending lot of money to buy the medicines, and also they are what is it? Expecting lot of things to check our body. So we are taking X-rays, MRI, laboratories. So lot of testing we are doing. So we are spending extra money. This is not owned by the government, run by the private. So, and also we find lot of medical shops outside. This also run by the private. So in village, this private hospital or the clinic, we can call it as registered medical practitioners, RMPs. So in that public, we can call it as primary health center. In this private, we can call it as registered medical practitioners. See that healthcare and equality. Is adequate healthcare available to all? See this picture, children. See lack of bed, so some people are lying down. Now private hospitals increased, but public not yet. Private services are concentrated in urban areas. Yes, nowadays you people are moving on Coimbatore, Chennai, Bangalore to get the treatment because it also one type of stereotype the people or the society created. There you just go and get the treatment, then it will be cured. And also we are spending lot of money. So the cost of the services and medicines are high. Many tribal areas have few health centers. Tribal areas means remoted areas. So there they do not run properly. Even though what is it? It is not run properly. So what can be done? So what we can do for this? But it is the responsibility of the government to provide quality healthcare service to all, especially the poor and the disadvantaged. So poor people and all what they'll do if we have money we are moving to the private hospital. If they don't have the money what they'll do? And also nowadays we people are hesitate to move inside of the government hospitals. So whose duty to make it clean to the government hospitals? See the next slide, children, the Kerala experience. See, this is the hospital from the Kerala. So in 1996, the Kerala government made some changes. What changes they made? 40% of budget was given to the panchayats. Panchayats means third level administration. That is our rural development. To take care of water, food, women, education and health development. See the next slide, children. Costa Rican approach. See, Costa Rica is one of the healthiest country in South America. They concentrated on health, education, and basic needs of the people. You just see one simple picture, you will identify how they are concentrated on the people welfare. So now you just improve your knowledge, children. Get the details about primary health centers in your area. Please find out. Have you visited city government hospital anywhere? Why do you feel uncomfortable in quality there? Take a list of private and public hospitals in your locality. Compare the cost of treatment for the both private and public hospitals. Why postmortem done only in public hospital? Please get the details or the information from your parents or in the outside. So check your listening skill from this session. What is the expansion of PHC? What are the types of healthcare services provided in our India? Which is the healthiest country in South America? What are the things need to improve in public hospitals and its services? Whose duty is this? Conducting camp announcements regarding diseases, awareness, etc. Thank you, children.